Underpaid, overworked doctors and nurses are not going to recognize the mental health of
Mm-hmm.
patients. I know that sounds harsh, but it's a fact.
Fibroid does not prevent a woman from getting pregnant. It doesn't.
There are different forms of birth control, and many women tend to mix up emergency contraceptives with birth control or family planning.
Between sanitary pads and condom, which one should be cheaper? My name is Nurse Precious, and I'm hosting today's episode of Medic Talk. Today, I have three amazing health professionals. On my left, I have
Hi, I'm Nurse Jaypee, a registered nurse and a reality TV star.
and
Hello, my name is Lope. I'm a medical doctor and a lactation counselor.
why on my right, I have.
Hello, Dr. Njoku, a consultant obstetrician and gynecologist.
So, Dr. Njoku, as an obstetrician and gynecologist, could you clarify the importance of pap smell for young women, debunking the myth that are unnecessary?
Cervical cancer, the cancer of the neck of the womb, that's the cervix, is the second commonest cancer in our environment, beside breast cancer. And the good thing is that it's completely preventable.
Hmm.
Yes, that's where we have pap smear. Pap smear simply means that from time to time, we take a scraping of the cells of the neck of the womb and view them under microscope to see whether they are abnormal. So before we have the cancer, we have the what we call a pre-malignant lesion. That's a lesion that is not cancer, but that can progress to cancer. So that's what we do about pap smear. So pap smear is a method where we can periodically check this neck of the womb. And if we notice that there's an abnormal cell, they are treatable at that point. So pap smear is very important to prevent cervical cancer in our environment. And what causes this cervical cancer is a virus called human papillomavirus. It's transmitted from person to person through skin contact. And it happens after a girl have resumed sexual activity. So 3 years after, or from the age of 21, it is recommended that every girl or every young woman should have this pap smear 3 yearly to check for these abnormal cells. And if they are there, they can be treated at that point before they progress to
Okay.
cervical cancer.
Thank you so much, Dr. Njoku. Nurse JP, from your experience as a registered nurse and social influencer, how would you address the myth surrounding birth control pills and weight gain? You know, some women they'll be like, I don't want to do family planning, it's gonna make me fat. You know, how do you address this?
This is a conversation that I've had, on my page, something I've conversed a lot about with many ladies. And one thing I always make sure to let people know is that every woman's body is different. First, you cannot judge what would happen when you use birth control. Birth control doesn't actually make you add weight. What might happen is that it might be more difficult to lose weight if you're trying to lose weight when you're on birth control or add some weight, but it doesn't actually have you add weight. So what you need to do is, read up on, another thing I always say is you don't use medications by yourself. You don't just go to a pharmacy and purchase any form of birth control. I would always advise that you go to a hospital, speak with a gynecologist. You might have health conditions that you don't know about. That way you're able to converse with the person. He's able to do an intense, history taking of your health before then. He can prescribe to you what he thinks is better. Another thing we don't know is that there are different forms of birth control. And many women tend to mix up emergency contraceptives with birth control or family planning. So I would always advise that we go to a hospital, speak with your doctor, who would in turn let you know what he thinks is better for you. That way you know what you can use. And if after a while you think that the symptoms, are not things that you can cope with, you can always go back to speak with your doctor, the person who had prescribed it for you initially, who can, decide, oh, I don't think we should keep you on this. I think we should switch to something else. And basically the best way to go about getting birth control.
Thank you so much, Nurse JP. Dr. Lope, in your role as a medical officer and breastfeeding counselor, how do you provide support and resources to women facing unwanted pregnancy?
First of all, this starts with prevention.
Okay.
because there used to be this poster from Pfizer for one antibiotic where and the tagline was prevention is the cure. So I think for a lot of sexual related diseases, prevention is the cure. But that's not realistic. I can't tell everyone to abstain and have them listen to me. Not everyone will abstain. So apart from prevention, I also think protection. Like you don't assume things. People assume that okay, they are just having sexual intercourse with one person, that person is just having it with them. And I mean, it leads to a risk for infections. But also, even with unwanted pregnancies, if you don't use protection, there's a greater likelihood for that. And the issue is in Nigeria, abortions are illegal. So if you're going to get an abortion in this country, then it's probably going to be an unsafe abortion. So you have the risk of infections from just getting an abortion, and there's a cascade, there's a domino effect that just goes wide. So I always start with let's deal with the cause, so that's prevention, and then we move to protection. But if it comes to it and you do present with a pregnancy that wasn't planned or wanted, the next thing is counseling, because legally you can't abort in a space that's safe, in a space where things will be controlled, and you'll be able to hold the people caring for you legally, to any complications that will arise from that. So I would say prevention, protection, and then counseling. So I just properly counted them on the risks of of an unsafe abortion, and then how to prepare for motherhood, because that's the next step.
Okay. Thank you so very much. In your respective roles, what strategies do you employ to promote self care practice among women, including the importance of menstrual hygiene? Nurse JP.
Um, Basically, it's having conversations. I think as a woman, it makes it easier to deal
Mhm.
with. One thing I make sure to do is to let women know that, I experienced this as well, and to give realistic methods, because we cannot assume that everybody has access to everything that we need. It's like the question you asked at the beginning of the podcast: sanitary pads or condoms, which should be cheaper? Because sanitary pads are very expensive as it is. And I go on social media, I see a lot of options. Women talk about now having to use diapers, baby diapers, because in fact, while it is cheaper, it also absorbs more. So another thing we have to do is create a safe space for our women, for our ladies. We can't have them have the idea that this is a topic that must not be spoken of. I can't tell my daddy about it. When I'm on my period, or I start my period and I don't have a father, there's nobody to talk to. My mom has gone, look, I can't tell my brothers. You tell your brothers, oh my God, you get out of my room. Like, we need to let everybody know that this is a conversation to have. It is a normal experience. Every woman would experience it. So we have to do something called education. Let our families, as you're raising all your children, let your male children know that, oh, your sister might have this, your sister might have that. And hygiene is very important to teach. Let them know that, washing your body, cleaning your body, because ladies in rural areas sometimes have to use clothes that they can wash, disposable
Yeah.
clothes and all of that. Whilst we cannot always provide sanitary pads for these people, the best we can do is constantly hammer on hygienic practices and things they can do. Having your bath, always staying clean, making sure to wash all these things. Because there's just no knowledge about this. Women are, kicked to the side. Some men don't let their partners cook for them on their periods. There's a word for it now, but there's just so much, pushing to the side, no conversation about it. The very important thing to do is education. Talk about these things, and then provide as many solutions as you can. We have people who go to communities to give free sanitary pads to the ladies in the communities, and then we have people who also provide other ways of which you can. There are these disposable clothes too that non-profit organizations give to women in communities, reusable clothes and all of that. Just teach proper hygiene on how to use these things for the things you have to do. And even when you are, able to use sanitary pad, proper disposal, knowing how long to use it for, not using one sanitary pad for an entire day, and all of that. Just proper education and proper hygienic teaching is always important.
Thank you very much, Nurse JP. Dr. Lope, how do you believe health workers can better recognize and address the mental health needs women, especially in the context of reproductive and maternal health?
This starts beyond just healthcare workers. First of all, this starts with policy and at maybe like a federal level and then a state level. And it starts with better pay and less working hours, because underpaid, overworked doctors and nurses are not going to recognize the mental health of
Mm-hmm.
patients. I know that sounds harsh, but it's a fact. If you've been on call for 48 hours, you are unlikely to sit down and have a proper conversation with someone just to allay their fears. So I think there's a responsibility on the government and then the CMDs of hospitals for that. So for us, the nurses and doctors and everyone else in the hospital, what can we do? We need to be more patient. Sometimes you are exposed to so much information that you think that this is obvious, they should know. So remember that no, like because you've been exposed to it. It's not like common knowledge. You know what I mean? Even to Google it, you have to know what you are looking for. You can't just decide to go into the rabbit hole of women's reproductive health online. So I think we need to be more patient and we need to give more grace to patients as well. I also think that in putting ourselves in the shoes of patients will help. I don't know if you've noticed, but like now, men who are like OBGYNs are much more understanding of women because they've seen it firsthand. They know what it's like, like I mean they don't know what it's like, but they can relate in a second hand way, but as close as possible as a man can. They've seen women die due to like complicated labor or maybe just unsafe abortions and things. So they extend more grace. They won't be as harsh and they won't be as unrealistic as men who have no knowledge of what goes on inside, like an
Mm-hmm.
obstetric ward.
Mm-hmm.
And then also women. Women are also give lots of grace as well, especially women that have given birth and stuff. But if you've not, because a lot of us are still young, if you've not gotten there, I think patience and grace will go a long way. Just be keeping it in mind that they don't know what you know, and that's why you're here to just help.
As a gynecologist, how do you navigate discussion about potential relationship with fibroid and debunking any misunderstanding?
Yes. Fibroid is the commonest benign tumor, that's non-cancerous tumor in women. And nulliparity means that a woman that have not delivered before. So there is often this saying that a woman that doesn't carry a baby carries fibroid.
Mm-hmm.
But there is more to fibroid than having not delivered before. This issue of age come into play, the issue of family history come into play. Um, Fibroid have been said that it's more common in women in their late 20s, early 30s than women in the early 20s and below that. It doesn't mean that it doesn't happen earlier. I have seen a fibroid in an 18-year-old young girl.
Mm.
Yes. So also it is commoner in women that haven't delivered before than women that have delivered before. But I also have seen fibroid in women that have had two or more children. So it's actually a complex relationship. But looking at the statistics, yeah, it's common in women that have not delivered before than women have delivered before. It's common in women that are in the late 20s, early 30s than women that are in their early 20s. But the thing about fibroid is that from probably from around 25 is good for every woman to do ultrasound scan periodically to check whether they have fibroid, because you really can't tell the one that will have it or the one that won't have it, because it's a complex relationship with age, with having delivered before or not. And when we have this fibroid early, it's easier to treat because it's not always surgery as usual. There are some other treatment method like the high intensity focus ultrasound that we can use to treat fibroid when they are little, when they are smaller. Now we're just using ultrasound to focus on the fibroid and keep it, and it will shrink without doing surgery. But when it becomes bigger, which when the woman have seen the fibroid or when she haven't noticed it, but she'll feel it, there's something growing in her tummy. That time it has become bigger. It's difficult to treat. And that's the one we say, okay, most times it's surgery. And fibroid surgery has its own share of complications.
But does fibroid disappear? Because some people they'll be like, it's going to disappear. Don't worry. All these alba.
Yeah,
Yes,
yes.
they take so Dr. Njoku, what do you advise? Do you advise we take alba products or we should just do surgery?
Yeah, the issue with herbal product is that some of these products we don't know the chemical ingredient of that product.
Hmm.
And we don't know the effect on the organ system. Some of
Mhm.
them are called, a lot of people are having kidney problem in recent time. Probably it's herbal medication that are taken over time. And they don't have dosages because every drug have complications, have side effects. Every drug we take. But the issue with conventional drug is that there is dosages so that when you don't go beyond the safe dose. Yeah. So the herbal things, there's no dosage because it has not been formalized or regularized. So some of these things can have have effect on the kidney and other organ system. So that's one thing about the herbal thing. Then pertaining to fibroid, some of these medication can actually kill fibroid, but it doesn't disappear, so to speak.
Hmm.
Yeah. Also, some of them can even make the fibroid to grow because fibroid tend to grow with hormones. Like the female hormone, which is the estrogen and progesterone, encourages fibroid to grow. So we wouldn't know the herbal remedy that have these hormones that will either shrink or grow fibroid. Yes. So it's advised to follow the conventional medical method, which is the HIFU, which is the non-offensive I mentioned, or the surgery. But let me state that it's not all fibroid that need treatment.
Okay.
Some need waitful watching. You have to do scan over time to see how they are growing, the tiny ones. And most of the times, one thing that determines whether we treat or not is symptoms. If they are not giving you symptoms like heavy menstrual bleeding, frequent urination, abdominal swelling, there is no need to treat. And fibroid does not prevent a woman from getting pregnant. It doesn't. Yeah, it might have complications in pregnancy like pains, miscarriage, depending on the site of the fibroid.
Okay.
Thank you.
Okay, so you heard Auntie Shiamaka. Do not take any herbal treatment for fibroid. So it is better you go to the hospital and see a gynecologist. Nurse JP, from your perspective as a registered nurse and social media influencer, how can social media platform be leveraged to increase awareness and education about women's health issues?
This is a question I like very much. I feel like a problem we have in Nigeria, I don't even know if it's a problem, but the thing that we have in Nigeria as medical practitioners is that we are made to believe that medical practitioners are just that, medical practitioners. We are never beyond that. And I think it's one of the reasons that made me want to break into the entertainment industry and, just be something different because right from when I was in school of nursing, I could always see that nurses, especially the female nurses, you finish school, you start to work, you marry, you give birth to children, you end up being a matron that is very angry at 50 years old. But that's a conversation for another day. But yeah, basically, I mean, we know a very popular doctor who does this, health conversations, who is always saying Amaka, Emeka. And then I also have a health series called Health Tips with Nurse JP, where I try to have these conversations in a very casual manner, such that people are not afraid. And by the time I drop an episode, there are a bunch of questions under my comment sections. And because I'm a young person, it's easier for them to communicate to me. Also, I'm a lady. And I think I realized that even before I started this health series, because I realized that when I used to be very friendly on my social media, and people would just come into my DMs with questions that you can tell that they are scared to go to the hospitals for. So basically, social media is probably in fact, the best way to communicate with people health-wise. They are always on social media these days. So from kids, from medical personnel realizing that they can be more than just medical personnel. If you have this information, I mean, how many people will come to the hospital? First, people can't even afford. There are people who I recommended going to the hospital to who have told me I can't afford to go to a hospital. Sometimes I have to insist. I'm like, I can't prescribe drugs to you on Instagram. You do have to go to a hospital. But I mean, because of social media, I'm able to tell people, oh, don't just go to a chemist. Oh, don't just go and buy antibiotic that your friend used. Actually go and see somebody. Let them run tests because what you are treating and what your friend is treating. So I think that medical personnel should come out. Let's speak more. Honestly, we are doing amazing. I have this blood drive that I do yearly. And because of the little influence that I have, I'm able to gather celebrities, people to donate blood for free, to educate them on this blood donation. And that's just me as one medical personnel. The same thing as Swift Medics is doing. It's because he's in the medical industry that we are able to do this. So I think that medical personnel, especially with the young ones, should come out more, talk more. You don't have to do much. You don't have to create kits. Do whatever is convenient for you. I also see that a lot of hospitals nowadays, have Instagram accounts,
Of course.
TikTok accounts.
Mhm.
That's also very helpful because, like I said again, 90% of of human beings on social media. Even our parents, I used to say, drop your phone, drop your phone. Now our parents have so many false information. The things, even my mother that is the mother of a nurse will send to me and say, Belumi, they say that you should not drink something. So I say, but your daughter is a nurse now. Don't do this to me. So yeah, like we need to go there and negate the false information that is being spread on social media. Like honest, social media can do so much amazing things for us. So come online, type out the things. It can be a tweet. There are also these doctors who drop these threads of tweets, kidney conditions, stuff like that. Just come out, say what you're thinking. I mean, always confirm that what you're saying is right, because they will drag you. But yes, come out, tweet these things that you're thinking, post them on your Instagram page, on your TikTok, and honestly, it will do so many amazing things for health in the country as a general.
Thank you very much, Dr.
Okay.
Lope. In your experience, what misconception do you encounter regarding necessity of STI testing for asymptomatic women, and how do you educate patients about importance of regular screening?
Thank you so much. Um, Serially transmitted infection is infection acquired due to sexual intercourse, and it's actually on the rise recently, pertaining because of lifestyle changes. Now, for women that have no symptoms, because some of the symptoms are vaginal discharge, pelvic pain, and for women that have no symptoms, it's recommended that from time to time they should go for testing, especially women that are in a relationship where they have, say, unprotected sexual intercourse with their partner, because you cannot tell whether your partner has other partners. So, and some of these infections like the HIV, the hepatitis, B and C, and other STIs, what we are talking about. So it's very important to periodically have this testing done, so that if one has such infection, we can he can be treated early, because this infection has some sequelae down the line. They can cause ectopic pregnancy, secondary infertility, or primary infertility down the line. Yeah. So it's important to periodically, for people that are in relationship where they have unprotected sexual intercourse, to have this testing done from time to time.
Some men they be like, I don't have any problem with me. It's always about women. So what do you think you can we can actually do to all these men, especially those that has genital warts, and they will give their partner genital warts, and at the end of the day, they will be blaming the woman. Okay, you are the one that gave me this infection, whereas it's the carrier.
One thing about sexual transmitted infection, that word sexual, it takes two to have a sexual relationship. So even when we are treating sexual transmitted infection, we recommend to treat both. Because if you treat one person, the person untreated can reinfect. Yeah. So when we are treating sexual transmitted infections, infection that we treat both. Because if you treat one, the other one may be a reservoir to reinfect the other. So we treat both. Nurse, what do you think about it?
So you're very correct, and I understand what she said, because in the world, realistically, men, and are usually likely to say, no, this is not my fault. No, this cannot
It's
be my
always
fault.
about women.
It's also
Always about women.
a similar conversation to what's it called now, infertility. Many cases don't realize that the problem could be them. It is, why can't you get pregnant? I think that one thing that is usually done is medical, or at something I've experienced, PHCs, medical practitioners usually insist. They tell the women, please go home and tell your husband that we would like to see him as well. Because if you have, also let him know that he could be at risk. And this is no longer a who is at fault, who is not at fault situation. Who gave who the problem. You let him know that this is not a fight. This is not a blame game. It's not blame shifting.
Exactly.
Tell him that if your wife is treating something, then there's a likelihood that you have to treat as well. You just educate. It's not a fight. There's no judgment here. There's no, I think you're at fault. Oh, you are a man. You must have brought it. We need to learn to relax and come from a non-judgmental angle. Just let them know that if she has gotten this, then you're at risk for this. So please come so we can test you as well and treat you as well. And even when he goes on to insist, but I don't have any symptoms now, she's the one that is having discharge, let him know that there's something called asymptomatic carrier. You could have this thing and not have any symptoms. So just to be on the safe side. Let him know the possible consequences. That if you start to have symptoms, it can be very, discomforting. If you start to have discharges, if you start to have painful urination, you can be in a lot of pain. So just come, just let's be okay. You think you don't have it, yeah, come. Let's just confirm that you don't have. As soon as we see that you don't have now, Shebi will let you go. So we just always need to come down to their level. Like she mentioned earlier, keep in mind that you are the medical practitioner. These people are, for lack of a better word, laymen who don't have the knowledge that you have. So we need to put ourselves in their shoes as well. If I did not go to nursing school and somebody came at me with this kind of conversation, how would I want to be approached? So that's honestly, a very good way of handling. Let them know that you could be at risk and we're just trying to look out for you. There's no blame game. There's no you're at fault. We need to remove the fight first. As well as medical practitioners, it's our, job to make the peace. Here is not a place of counseling. I'm not counseling, but it's not a place of law. It's not a courtroom. It's just trying to give you the best health care that we can. So that's zero judgment. It's not our job to judge. It's just try to make sure that you're in good health, prevent complications, prevent consequences, prevent terrible prognosis, basically. So that's what we can do.
Thank you very much. So you men, it's not always about women. So you too, you can actually go for screening. Thank you so much, Nurse JP. So Dr. Njoku, do you think menopause is the end of woman's sexual life?
Thank you so much for that question. Menopause, which is when the woman stops menstruating in our environment, is around the age of 51 years. Is actually a topic that in this part of the world we tend not to pay much attention to compared to the Western world.
Yes.
Because there's a lot of events happen in a woman's life at menopause. What happens is that the estrogen and progesterone, which is a female hormone, stop production because the egg store of a woman is, so to speak, depleted. So there's no more production of estrogen and progesterone, and something happens to the woman's physical body. One is that the vagina becomes dry. One, they feel irritable. They are what we call the hot flushes and night sweating. It happens. And because of this, and also the libido, which is the sexual drive, tends to reduce. Because of these changes, a woman tends to be uninterested about sex. But it shouldn't be the end of a sexual life in women, because there are some things, both the psychological support and some medical things that the woman need at that point in time for her to still enjoy sexual relationship. Things like what we call the hormone replacement therapy. We can actually put back this estrogen and progesterone that is lacking in women for those symptoms, those changes to reverse. So the woman will still feel young again, still enjoy her sexual life. And also they need a lot of support from their spouse and people around them. So it is actually not the end of a woman's sexual life. It's just that it's a phase in life where there are some changes that can make a woman become uninterested about sex. But they still need, it can be reversed for them to start enjoying their life again.
Because they need to enjoy it.
Okay, so I want to ask one question particularly, because about let's say like 40% of women of childbearing age tend to have high prolactin. There's this thing called galactorrhea, if I'm right.
Yes.
So they have high prolactin, and it makes their nipple discharge, maybe milk or this white fluid. So what really causes that high prolactin?
There's this hormone in the pituitary gland. Pituitary is a gland in the brain. There's a gland in the brain, in the middle of the brain, called the pituitary gland, that produces what a hormone called prolactin. This prolactin causes the breast to produce milk. Normally, in women, it's high when a woman is pregnant or breastfeeding. That's when naturally the body triggers that prolactin in preparation to breastfeed the baby. But sometimes it's high even when the woman is not pregnant or not breastfeeding. Some drugs we take can cause that prolactin to be high. Yeah, some of these drugs, like drugs that have dopamine, some drugs that anti-vomiting drugs, some antipsychotic drugs we give to mentally challenged people. Some of these drugs can trigger that prolactin to be high.
Hmm.
And the woman starts producing milky discharge from the breast, even when they are not pregnant or breastfeeding. And what is the implication of this is that this same hormone have effect on the ovaries.
Hmm.
Can make a woman not to ovulate.
Hmm.
So the woman now starts having probably irregular menstrual cycles.
Hmm.
Some of them that are married and want to conceive may have challenges in conception.
Hmm.
Yes. So there are some drugs that can reduce this prolactin level. And once it's reduced, the menses comes back, the ovulation comes back
Hmm.
to normal. But sometimes it's also good to see the doctor because sometimes there are some tumors on that pituitary gland can make these things to be high. So at that point, drugs may not help. So we need to investigate. Depending on how high this prolactin, we need to run some investigation to make sure that it's not tumor. Because if it's tumor, there's other ways to treat that. Yeah, thank you.
Thank you so much.
Thank you. So I wanted to ask Dr. Njoku about the menopause thing. You mentioned HRT, the
Yes,
replacement
hormonal
therapy.
replacement therapy.
So if women don't want to do that, because I mean, I assume that not everybody will be able to afford it, and the truth is that not everybody would know that they can do it. So if they're going through menopause and they're expressing all these changes, but they still want to enjoy like sexual relations, or they just want to feel young and live their lives normally, what can they do?
Yeah, it boils down to information and awareness because there's a lot of misconception in our environment that this causes that, this causes that. So when you take your time to explain the benefits of this, there are some drawbacks anyway, because those replacement therapy might cause the lining of the womb to be thickened and the rest and predisposed to them to other things. But when you explain to them about the benefits, because there's another thing about the menopause is that when this estrogen is withdrawn, the bones become weaker. They are prone to fractures.
Hmm.
Yes. So these are some of the benefits of the hormone replacement therapy. But still is their decision to make. When they say, okay, they don't want that and they want to enjoy sex, we can bring something like lubricants.
Okay.
Yeah. For them to, because of the vaginal dryness, for them to enjoy sex. But the most important part of menopause is the psychological counseling because they are irritable. They have night flushes is usually terrible. They need people around them, and that's psychological counseling. Yes. There are some supplements you can take,
Okay.
calcium supplements you can take to make the bones stronger.
Okay.
Yeah.
Thank
I'm
you.
of the opinion that he said something. Oh my god, that just skipped my mind. But yeah, it wouldn't always be a medical approach. Yeah, he said something
Yeah.
about most of it is psychological.
Yeah.
So I don't think that everything would be a medical approach. Like if you have hot flashes at night, if you have night sweats, we can recommend, lifestyle changes, maybe late night showers to enable you sleep well. If they have partners, if you're married, because many of these things will not just be like I said, some of them cannot afford the replacement therapy.
Yeah.
So if they have a husband, a partner, speak to both of them, counseling. Let them know that she also has to assist her psychologically. You also have to know that it would not be magical. She would not just want to have the sex. Okay, now that she has reached menopause, maybe both of you are approaching retirement age, you might now start to actually catch a break, like, enjoy yourselves, go back to doing fun things like you used to do when you were younger. Don't expect that it would all be the same as it has been. Let them know to have to try different things and be patient because if you're menopause at 50, don't feel like you have to get it sorted out instantly. Let them know that it's okay, it's normal, you can take it one step at a time as it comes, like that.
Yeah. Also, one misconception: hormone replacement therapy is not expensive. Yeah, it's not.
Okay. Right.
Yeah.
So,
Can you give us a range?
so
Yeah,
that
it's basically the common estrogens and what different
the
dosages. It is basically the same estrogen and progesterones we use for menstrual disturbances and contraception, but different dosages. So it's not pricey. Like
Okay.
there is one huge sum that you need to use for hormone replacement therapy.
Thank you.
all right.
Thank you so much, doctors. Thank you so much, Nurse JP. So, Dr. Lope, as a medical officer and breastfeeding counselor, what challenges do you observe regarding unintended pregnancies and potential complications like ectopic pregnancies? And how do you empower women to make informed decisions about their reproductive health?
Okay. So for unintended pregnancies,
Mm-hmm.
because it's not planned.
Yeah.
A lot of women are not even on folic acid before they get pregnant. I
Mm-hmm.
mean, I know that, yes, if you're a reproductive age and you're a female, you should be on folic acid. But not a lot of
Mm-hmm.
people know that. And I think, life just happens. Like, is that really top priority for a lot of people, to be realistic? So not a lot of people are on folic acid before they get pregnant. And you're supposed to take that like before you even conceive. So there's that risk to the child, that the child will have some defects. But then some people don't just like, they're already pregnant and they don't know, especially for people that already have irregular periods. So it's until something happens and then they find out, and it's like, okay, so you've not been taking the supplements, because there are drugs that every pregnant woman should take just for her health and the baby's health and things like that. So their system isn't as optimized as it would be. But I think the most urgent complication would be, just abortion, because again, it's not like, there's no even open discussion about it in Nigeria. It's not legal, so if you want to get it, you have to go to some back end somewhere. So that's the thing I see the most, and I think that's really the scariest thing, because like, it affects so much. If the quack does a botch job, they can get sepsis, and just there are just too many domino effects following that. So I would say unsafe abortions are like the biggest thing I see with unintended, unplanned pregnancies. So how do I counsel women? Um, it's always holistically. I like to involve the family, because nobody's an island, and they are going to be in a family setting. Because a lot of people are also dealing with what their parents think, what their friends think is disrupting lives. Some people are in school, either secondary or university, and sometimes they can't. It's not like they can't even go to class. It's just that they'll be ashamed. You know what I mean?
Mm-hmm.
So that stigma is there. So it's about, honestly, psychological, because I can't legally even ask you to consider an abortion. You know what I mean?
Yeah.
So the only legal option is to keep the baby. So you need to be prepared for that, because it's going to change your life forever. There's no going back from having a kid. You're always going to have had a kid.
Mm-hmm.
So it is really about psychological support from their families and friends.
But I've seen like about, if I'm not going to exaggerate, let's say 25 cases whereby a let me just say I've seen like ectopic pregnancy, like many. So what do you think causes this ectopic pregnancy? Like what really causes it?
Okay, I'm going to throw that over to Njoku.
Okay. Yeah. Thank you so much. If I may come in here, on unwanted pregnancy, unsafe abortion, ectopic pregnancy is actually a cycle. I say it's a vicious cycle. That's it start with unwanted pregnancy, unsafe abortion with complication. But we can only stop this cycle from the beginning of the cycle, which is contraception.
Mm.
And we have a lot of misconception about contraception in our environment. Is our unmet need as contraceptive unmet need in Nigeria is huge, because people tend to, like, it causes a lot of complication. It makes them gain weight. It affects their menstrual cycle. Yes, it does that sometimes, but it also have the benefits. And also some girls have this idea that they have not gotten pregnant before. They want to be sure that their reproductive system is working. They are fertile. They just want to get pregnant and remove it. And once you have done that, you have entered the cycle.
Yes.
Like the cycle keep going. Once you remove it, complication of infection, because obviously it's not legal, and they will get it on safe pregnancy, unsafe termination of pregnancy, abortion. It affects the womb. It affects the tube, cause the tube the tube infected, block it. The next pregnancy may result in ectopic pregnancy.
Mm-hmm.
Now, sometimes, depending on who is doing it, they may be overzealous in doing it. It can damage the lining of the womb and make them have what we call a shaman syndrome or uterine synechiae, where they don't menstruate again. And it down the line causes infertility. So the cycle, if we can lay emphasis on contraception, we will stop the cycle.
Yes.
And contraception, we have options, from the condom to the pills to the insert
Implants.
implants, to the intrauterine contraceptive device. So it's not one car fit all. Everybody has their
Yes.
own specification based on what and what and
That's
what you
true.
have.
But people still don't use it. Why?
I'm
Like
do
lots
you-
of girls still don't, and they're sexually active.
I'm genuinely of the opinion that there's not enough education about it. I promise you.
So you think they don't know?
I think they don't know. I think that if you put the options, the option of contraception and the so-called consequences that they believe are the consequences of contraception down, and then you put unsafe abortion and the consequences of an unsafe abortion, I guarantee you that so many women will go obviously for contraception. I had I spoke about contraception, on my health series, and the amount of people who came under that post to talk about how they did not realize that they had this option. Like I mentioned when I was talking about contraception earlier, many people have looked at the only form of contraception are the emergency contraceptives. The morning, and even that they don't know how to use it. People use that before they have sex and think I'm going to have sex with my boyfriend tonight. I will use it this morning and assume that I will not get pregnant after. Or they have sex now, use it, and then have sex after and think that the one that they've used will be waiting for this. So I'm of the opinion that honestly, it is lack of. I think we don't speak enough about it. I think it's not spoken enough about. Also, there's a stigma attached to it.
I was going to say
PHCs. I mean, I think that it just took having audacity for me to learn that, you know what, I really would not care what anybody thinks anymore. And I now had to start to, I have friends who will say, JP, please help me buy something. There's a stigma. I'm promise you, when you walk into PHCs, if you're not married, if you're not this, they ask
if you're
you,
young, if you
you are
look
young,
young, if you look like
especially-
okay, she's not married, you know what I mean?
why are you getting contraception? No. Many women don't want to go
So
through
maybe
that.
that plays a
If you
a
stay
huge
close to
part.
somewhere that you have family, is it me that my mother was the principal that wants to go and get contraception? The way me call Mr. Moss and say, we saw your daughter in Kiniko asking for implant. So I think that it is those things, the lack of education
And then
and the stigma.
stigma.
Those are the things we need to. I mean, our parents want to do the whole you mustn't have sex, you mustn't have sex. And we've heard stories of women who say they give their children condoms. And people say, you're enabling her, you're enabling her. But the woman says, it's because I can't guarantee what she would or would not do. I might teach her everything. She gets to school, she slips up once, she makes one mistake, she gets pregnant. But if she has the protection that can guide her, even if she has made a mistake, she can come home to me, I can still talk to her, but at least we prevented something that she doesn't want. I think we need to educate parents, educate everybody that the world is evolving. Yes, we'll teach you to not do this. Like you said, you can't convince everybody to abstain.
Can't.
Whilst we are trying to convince you to abstain, at the same time, let's try our best, educate, remove this stigma. We're in 2024, COVID has happened and changed the world.
I think maybe also even culture and the fact that we're so religious.
Yes, that's another thing that affects us in this part of the world. Cultural, religious practices, all those things. So I think that in fact, like honestly, that's just really what we need to do. A lot of education, stigma removal. Health first, safety is better than whatever it is they say. I was going to ask you a question, by the way. You said something about folic acid for reproductive age. Do you start to use it when you're as soon as you're in reproductive age, or at the point in reproductive age when you know that you might be thinking of getting pregnant? So if I'm a single woman, for example, I know that as a single woman, I'm not yet ready to have a kid. Do I start to use folic acid then, or do I wait until I'm married and I know that, okay, I'm ready to start to have children before I now start to use folic acid?
Okay, so there are two schools of thoughts. Some people think, and I agree with this more than the other one, that you should use it once you're in productive age. And again, this covers for people that have unplanned pregnancies. And unplanned pregnancies actually even in people that are in happy marriages. It happens, you see someone who's had like 3 kids and last kid is 12 and they have another kid. But some people think, just start using it before you start trying to get pregnant. But as long as you're using it before you conceive, you're good.
Again, you just said something about how people have had 3 children and then they suddenly have one 10 years later.
Yeah.
If I've had all the children that I think I want to have and I'm like, I don't want to have a kid anymore.
Yeah.
Do I then still continue to use folic acid because of the risk of I wouldn't call it risk, but of the possibility of having an unplanned child?
That's complicated because Okay,
so it's also have a relationship with our last discussion, contraception. So if you are in a relationship and you're not planning to get pregnant, it's recommended you use contraception.
Yes.
So pregnancy should be planned. In this type of the world, we don't plan pregnancy. We just wish let it happen. Even when you should plan it. And one of the things you plan for is the folic acid because it helps in the neural development of the spine development of the child. So you start taking it when you're planning pregnancy for this pregnancy. So it has this relationship with contraception. So if you know you want to get pregnant, start the folic acid.
Okay.
If you know you are not planning to get pregnant, use contraception. Even contraception is not for young girls, it's for even people in marriages
Yes, absolutely.
to space their children.
Yes. That helps.
But is it advisable to use contraceptive pills for those people that has not um, given birth?
Yes.
Like, it's advisable for them to
It
not cause.
does not.
There's no side effects.
No, they are excited about, but it does not make them to not conceive
It does
when
not
they
cause
stop the
effect.
contraception.
Yeah.
Okay.
So it doesn't have any fertility side effect.
That's why we mentioned going to a hospital, not
Exactly.
just
You're
not
not
just
supposed
walking
to
to
buy
a
it.
pharmacist
Exactly.
and
You're
say,
supposed
I
to have
want
a
to start
consultation
family
first.
planning.
Yeah.
Consult with a medical practitioner.
Yeah.
Unless the permanent method, there's some permanent method of contraception. That one is used for people that have completed their family, like
And
tying of the
tubes,
tubes
yeah.
or
Okay,
tying of
okay.
the somatic cord.
Mhm.
Yeah, that's a permanent method.
Okay, thank you so much. That was really, really interesting. Nurse JP, how do you advocate for holistic healthcare approaches, integrating lifestyle choices, societal influences, and personal circumstances in promoting women's health?
See, the word advocate it makes me remember school of nurses. Say nurse as an advocate. You're an advocate for your patient.
Mhm.
Advocate. So I think we've touched a little bit, a little bit on this in our past conversations. One thing I always like to remind us as medical personnel, we've said it earlier, is that we are in no judgment zone.
Mhm.
We're not a church, we're not a mosque, we're not
Your
our
parents.
culture, we're not Yoruba, we're not Igbo, we're not Nigeria, we're just healthcare practitioners. What anybody chooses to do with their life, it is not our business.
Exactly.
There's no small way to say it. Like, if you know that you're a judgmental person, don't dabble into healthcare.
Mhm.
As a healthcare practitioner, we are all that they have, because health is what we have. Our bodies are what we have. Health is where it starts and where it ends. So the best way to do this is to not judge, because people will live their lives. Everybody is, like you said, it's not one cap fits all. Everybody would not do the same thing. Even we who are the healthcare practitioners make mistakes from time to time. Even if it's not sexual, even with medication or with, they are so it's not a one cap fits all. So one thing I wish I tell everybody is that you can't be judgmental. We have to be prepared to hear all kinds of things and learn to put our personal opinions aside and give them what they require. Try to educate. We also cannot be too worried about not trying to come off a certain way and not tell them what they need to know. So one thing we would always try to do is in our practice, in everything that we are doing, we have to look at, another thing is not having a narrow-minded view. Always look at it from the other perspective. Like she said earlier, put yourself in the person's shoes. Always try to let everybody, carry everybody along. From the cleaners, I mean, recently we've been having these issues of celebrities have an accident, they're in the hospital. Before you know it, there are a million videos on social media and they say it's the nurses, the nurses, the nurses. But we forget that we have cleaners, we have gatesmen, we have, health assistants, we have a million people with phones. I don't even think that a nurse will see an emergency. And where you're trying to carry stretcher, you have the time to think of your phone. So we need to educate everybody. That's why it's a holistic approach. Educate family as well. Let everybody know what it entails. Well, when people come to us with healthcare, we are not to say, oh, this is wrong. There's no wrong or right when you are teaching these people. But let them know that if you decide to do this, these are the possible consequences. This is what I think you can do to help yourself be better. If you have to have multiple sexual partners, rather, this is how you can protect yourself. When women come and say, my boyfriend does not like to use condoms, you would use female condoms. Sometimes you also have to stand your ground. If he uses to use condoms, you can also insist that you don't wear a female condom, because if something goes wrong, it is you and your body. So we need to learn to educate. Put your personal opinions aside, how you feel about something, what you think, what you don't think. All of that doesn't matter. We need to remember that it is the patients first, their health. Like she has mentioned earlier, grace and patience. We need to be more sensitive. Like she said, it's really exhausting. People, medical, practitioners are overworked and underpaid. No, medical practitioners are overworked. But I'm of the opinion that, and I don't, not just with medical practice, I say with every practice, like if you're going to work a 10-hour shift, prepare your mind, just zero your mind for that 10 hours that these 10 hours, I don't have a choice. This is what it is. Come into that 10-hour mood. Come everywhere you are. Like say if you're in Rome, act like the Romans. Some employers will say, when you get to the gates, drop your family problems at the gate.
Exactly.
And in
Don't
fact,
bring your family
there are
problems to the
some
hospital.
hospitals, there are some companies abroad where they write, if you must cry, please go and cry in the bathroom. Like there are those funny things around the company and stuff like that. It's hard. There will be your off days. I mean, it's not every day that you're not to be willing to smile to you. Some days they are the mother just said that somebody died at home or that their mom was admitted or something. But as much as possible, don't take it out. If you think that you can not take something, you can ask a colleague to, step in for you briefly. Oh, please, I'm just very overwhelmed right now. Can you help me attend to that patient? And little by little, we also have to educate the public to take it easy with medical practitioners. When you go to a hospital, recognize who is who. Not everybody is a doctor. Not everybody is a nurse. Because not everybody is wearing scrub. Estheticians that are not even in the hospital are wearing scrub.
Let's
Everybody,
not start.
I see scrubs all over Lagos.
Even
like this.
hairdressers.
God bless you. Those that are doing spa.
I think it has become like a
Scrubs.
uniform thing for some.
So we need to also teach patients to, to be able to tell the difference. Ask who is attending to you as well. Those things, like I also tell patients, you have a right to healthcare. You can ask questions. I mean, just be cautious about the questions you're asking, but you're allowed to ask questions. You're allowed to say, oh, sorry, what are you giving me? How are you attending to me? If you have a problem, it doesn't always have to generate into a fight. Come out and tell the receptionist, can I speak to the doctor? I don't like what that person said. There are better ways we can handle these things. We can, because it's a vis-a-vis thing. It's a two-way street. So everybody just needs to be educated. And that way, hopefully, we can approach optimum, premium, better healthcare in Nigeria.
Thank you very much. So, Nurse Titi, please do not be judgmental. Do not judge your patients, okay? So, thank you so much, Nurse Jaypee. Dr. Njoku, this is for you. How do you navigate discussion on sexual health with patients, considering lifestyle choices and societal influence that may impact their well-being?
Okay. Thank you so much for that question.
Welcome.
Yeah, we are in the age of Gen Zs, and it comes with some lifestyles that we are not used to before, and those lifestyles have some effects on our well-being, reproductive care, reproductive health, especially things like we have talked about unplanned, unwanted pregnancies and unsafe abortion, then some complication, ectopic pregnancy. I talk about Asherman syndrome, that uterine synechia. Then everything resolves to infertility. So for us, is education, because people need to know what is what. That for every action there's a consequences. So they need to know, if you follow this part of lifestyle, look at what may results. So our role as healthcare professionals is to give this awareness, this education, and offer solutions where we can. That's why with the issue of contraception, which I talked about, that is to break this cycle of effect on lifestyle, on reproductive health, and ending with infertility, have to come in. Yeah, to break this. Yeah. Then other lifestyle, like things like smoking, also have its own things on reproductive health. Things like it can affect the ovarian store. Yeah, the ovarian store can be depleted quicker. Yeah, so these are some of the lifestyle that we do. People do, and they don't know the reproductive consequences of this lifestyle. So it's in our place, our healthcare professional, that we know better, we educate these people so that when they engage, there's a consequence of this lifestyle. So, Jaypee, what do you think?
Yeah, I absolutely agree with you. And it's just similar to some of the things that I have mentioned. I was just thinking about, it was just dawning on me in this very moment, which I'm going to confess why, because you see this folic acid conversation. If I'm telling you that I am just realizing that I'm telling, and in fact, I saw it on Twitter a couple of days ago. So it was just weird that you put it. I'm like, okay, Nurse Jaypee, what have you been teaching people this entire while? And I'm just realizing the amount of uneducation and miseducation that is out there. And I'm just realizing that, honestly, I think that we have a lot of work to do. And honestly, not just even in this part of the world, in general. So like he has said, we just need to, I don't know how much, I feel like it starts from the very grassroots, from primary school, because the things that foreign kids know in primary school, some of us were learning it in SS2 and SS3. Biology, they were doing it since their grade and all of that. So I think that we need to move away from a point where in Nigeria we feel like kids are too young to know a certain thing. I mean, I'm not saying tell them everything and open everything up to them, but little by little, we need to start saying, like he has said, nobody's judging. Like there are different reasons for different things. But if you told this part, then know that this could happen. If you are in a polygamous family, know that you have to find a way to protect yourself and ensure that everybody is staying safe rather. It's like how everybody, and everything is just about sexual conversations. It's like how in this part of the world, everybody says, but our parents have been using herbs since. People just came now, and it's like he said, we don't know the chemical things that are, you don't even know where they are making it. Today there's moko kini consumer, there are a million of them out there, and then there's no dosage. They'll just say, open your mouth, they'll pour half the bottle into your mouth. They are not regulated. Yeah. You don't know where they are making it, the hygiene of those who are making it, and all of that. So there's just letting them know that, I mean, you're allowed to do what you would like to do, but this is what you should know. Like, and this is how you can prevent. Many people will still go ahead and do those things even when they know the consequences. So the best way is to let them know, okay, this is how you can prevent. This is what you can do. This is how you can stay safe. And yeah, hopefully it just gets better.
Okay, so Dr. Ujoku, I really want to ask this question. Is actually from one of our followers on Instagram. What really causes this ovarian cyst, and does it really disappear? Like, does it really disappear?
Thank you very much. The ovarian system is just when there's a water-filled fluid or balloon in the ovaries. Ovaries is where the eggs are produced. And now there's a lot. Ovarian cysts have a lot of classification. There's the ones that are functional cysts. It means that every month for a woman to ovulate, the ovary have to form a small cyst, probably below 2 centimeters in diameter, and it would release the egg. That one is a functional cyst. Every woman have it just before ovulation. Then there are some ones that are not functional. It means that it is cyst, but it's not very big. Yeah, any cyst below 5 centimeters, we don't intervene unless it's giving pains, which is symptoms. So those ones we watch, we do ultrasound probably 3 monthly or 6 monthly to see some of them disappear. Then there is those one in the young, if a woman is younger, maybe in the 20s or before 20s or early 30s, we are not worried. But if a woman is having cysts around 40 years old and she's having cysts, we are worried because some of those cysts can be cancer. Yeah. There's another cysts that are common in younger women. We call them the dermoid cysts. The cyst is benign, but it contains some solid components, like you can see bones, teeth, and in the cyst. We call dermoid cysts. It's common in younger women. But after the age of 40, every cyst a woman is having, we are suspicious because some ovarian cysts can be cancerous. So at that age, even when they are not symptomatic, there are some things we can see, like there's fluid collection, the character of the cyst on ultrasound scan that we can also, there are some tumor markers also we can do through blood that can also help us to know whether they are cancerous or not. But any cyst after that age of 40, depending on the size, we need to remove them through surgery. So it's actually a myriad of experience depending on the age of the woman, the size of the cyst, the nature of the cyst, and the symptoms.
Do you have any contribution, Dr. Njoku, to what he has said? Any addition?
I think he was very thorough. He's my chief
that's
after
the
all.
perfect word.
I can't say more than my chief.
Very
Thank you so much, Dr. Njoku. That was really, really interesting. Dr. Lope, how do you approach the discussion about breastfeeding with new mothers, and what resources do you provide to them throughout their breastfeeding journey?
Thank you. I really like to talk about lactation. So I just approach it pretty straightforward. I mean, like, because e.g., if I see some women as soon as they deliver, so like it's such a vulnerable moment that there's not much you can hide. There's really no need. You don't beat around the bush. You kind of just, sympathize with mom and get right into it. And congratulations on that baby. Yeah. So I always like to ask what their plan is, because breastfeeding exclusively is best and recommended. But due to so many other things, a lot of women already plan from birth that maybe they're going to do formula, combo feeding. Some people just want to pump alone. They don't want to directly breastfeed. So it's just really about getting information from mom. Like it's not. I mean, to be honest, there is a standard and there is the best, because I know some people say fed is best, but that's not true. Breast milk is the best, but that doesn't mean that your opinions and your own experiences are invalidate. So you can, sorry, invalid. So you can, like I'm open. It's like, okay, so what do you want? Then I just educate them about, okay, so we formula this and this. Like for example, Guardian just released an article that Nestle adds sugar and honey to their formula, and the kids that are taking formula less than a year, most of them, and we know that we're not supposed to give honey to kids that are less than a year. So just open with, like, let them have all the information and decide for themselves, and then my own job is just to guide them to that, and then to help with problems. The common ones are like latching or low milk supply, sore nipples, things like that. So I always approach these conversations with an open mind and readiness to help, because I'm always ready to jump in if they need me to. Sorry, what was the second part of your question?
Oh, before I go into the question,
Okay.
some people actually want to do like exclusive breastfeeding.
Mhm.
And immediately they give birth. Some people don't lactate immediately, so they have to give their baby formula. So can they still continue the exclusive breastfeeding? Because normally exclusive breastfeeding should be breast milk only for the first 6 months.
Mhm.
So if they give their baby formula, can they still continue with the exclusive breastfeeding?
Yes, they can continue with breastfeeding. Just that now we cannot be exclusive
It's not
because there's a
exclusive
difference.
again.
Yes, but I mean they can still go the old way with breastfeeding. But that's not true. It's not everybody, barring an actual medical condition, has milk when they give birth. It's just that for some reason you think that your breasts are supposed to be leaking with milk. Like you think it's supposed to be something that you are seeing pouring out. No, you just need to put baby to breast. So it's a misconception that some people don't have milk when they deliver, barring a medical condition. Almost everybody does. They just don't know. They just think, oh, it's supposed to be more. And I think formula is actually the culprit in this, because you can see and measure formula.
Mhm.
So, you can see that this is 30 mils, this is 60 mils. You expect your breast milk to be like that. Like you expect that quantity. And you're not going to express 30 mils as soon as you give birth. That doesn't, I mean, it
Mhm.
happens for some people, but it's very rare. Few and far between. So, yes, you can continue with breast milk if you give formula for a couple days. And I mean, people that have emergency CSs might not be in the best position to breastfeed
Yeah.
just as soon as they're out of, surgery.
Mhm.
So then formula comes in and things like that.
But is it true that
No,
you
go
want to say
ahead.
something?
Go
Okay.
ahead.
Is it true that you have to breastfeed your baby for like 2 years straight? Some
Um,
people be like, no, I have to breastfeed you so that I want the baby to be so sharp and intelligent. Is it really true?
yes, you should breastfeed for at least 2
2
years.
years.
Yeah, but and that's the great thing about the time we live in. There's technology. So you don't have to always directly breastfeed. The point is, as long as you're taking breast milk. So even if you stop directly breastfeeding, and directly breastfeeding is just,
Mouth
babies,
to breast.
exactly. So even if you don't directly breastfeed from maybe when they are here, you can still pump and give them that milk, but it's just good for development. And some research says that it helps in reducing the incidence of atopies and allergies, and also it's great. More formula fed babies have obesity and diabetes, but we don't see that as much with babies that are exclusively breastfed and then breastfed up to year 2. So yes, it is good. You should breastfeed your child till they are 2.
So they are 2 years.
Yes.
And some people they will be like, I don't want my breast to be flabby, blah blah blah. And actually, it actually helps if they are breastfeeding their baby
Mm-hmm.
directly. It helps them to this cordial relationship
Bond.
between mother and child.
Yeah.
So would you say they should give their baby directly or they should pump it somewhere else?
Direct is, I mean, that's like your instinctive way. So,
Okay.
but the thing is that there are so many, like I've met mothers with very, like, maybe grotesque malformations on their breasts, so they can produce milk, but their child cannot latch on just because of, they've had like reconstructive surgery and things like that. So in such cases, you will pump. But again, if you don't want to, like, not everybody wants to for whatever reason. So yes, you can pump and just give your baby. But I would always say, like, directly breastfeed first, because that also helps you, even like how milk comes out, and just like the letdown and produce banana things like that.
Thank you so much, Dr. Lope.
You're
Thank you,
welcome.
Nurse JP. Thank you, Dr. Njoku. You guys are so, so amazing. Thank you for taking your time to come on our podcast today. So, guys, that will be the end of today's episode on Medics Talk podcast with Swift Medics Healthcare. Thank you.